Hello. Thanks again for the invitation, and I apologize for being late. I will describe some things about the contribution of MRI imaging in approaching of shoulder instability and the treatment options. So we have these options of a conventional MRI or MRI arthrography. It depends on what we're looking for, at which stage after the accident we are now, because we need about 2 weeks or more to have a good MRI arthrogram. I will state these 5 key points: the bipolar injuries, the capsule injuries, the rotator cuff injuries, the slap lesions, and the nerve injury. About the bipolar injuries, as we know, we have these 2 bony lesions, the heel sacs, but sometimes we cannot see it. Most often it happens in young patients, and we see this slight edema that we see to reach the greater tuberosity. And sometimes also we don't have bony bunkered lesions. So one of the main contributions of MRI imaging is to show these lesions. And we have these bunkered variants that are well known, and it can affect mainly periosteum or periosteum and the complex with the capsule and the labrum. Here, you have discussed, as I saw, about the bipolar bony injuries. And I have mostly performed CT scans to measure these bone losses that can be a bone fragment that is a recent accident, or a recurrent instability that has a glenoid defect that we also, as I told you, sometimes measure the normal glenoid, the contralateral arm. I won't state this because I know that Professor Di Giacomo has a lecture about this. I just wanted to mention that we had so many methods, and most radiologists, and I think clinicians also, agree that Pico 2D or 3D methods and best fit circle 2D or 3D methods are the most commonly used. Here I will overpass this. I want to say some things about the heel sacs measurement. We don't agree between us, and also in intra-observership agreement is low. But I think that we must measure heel sacs lesion if we can in 3 planes, and also to measure it in MRI, because we have to see whether we have the bridge with the greater tuberosity or it affects the greater tuberosity. So I agree with Professor Giftopoulos from NYU that has performed a lot of measurements about this lesion. Here are some measurements that we performed during these years with Dr. Adoidogiannakis, and we have written an article about this. So we measure these bipolar losses, and you go further to making the treatment decisions. What about capsule injuries? As you see, the normal, do you see it? Okay. The normal inferior glenohumeral ligament has this U-shaped normal appearance with the attachment from the inferior pole of the glenoid to the neck of the humerus. Also, we can see in the sagittal plane the anterior and the posterior bundle. All the ligaments are enfoldings of the capsule that attach from, start from the glenoid, and also fibers from periosteum contributes to its integrity, and then they go to the humerus, to be attached to the humerus or to several sites around with the capsule. So, when we have this inferior glenohumeral ligament trauma, we have the well-known HAG lesion that is one of the main contributions of MRI to the diagnosis. And here we have an athlete that has detached the ligament from the glenoid and also from the humeral head, the humeral neck. And here we have a large also HAG lesion, but has also a bony component, so we call it BHAG lesion. Sometimes we can have pitfalls when we overdistend during the MR arthrography the joint, or sometimes we have a pseudo pouch that we think that it's normal, but it's not normal because it's HAG lesion, but has adhesions with the humeral head. One serious thing about rotator cuff injury associated with dislocation or instability. Most of times we have a clinical history of persistent pain and weakness 2 to 3 weeks post-trauma, and sometimes you ask us whether we see a nerve injury, and this happens mostly in older patients or in high-energy trauma. So, sorry. Here we have the first patient that had this Hegel lesion. You see that has also a partial tear of the articular side of the supraspinatus. Also here we have a problem with the subscapularis and biceps tendon, and this is also something that we saw when we have problem with biceps. Most of times when we have dislocations, we have problem also with subscapularis. And the problem is that we don't have a very good sensitivity and specificity in conventional MRI to see well the subscapularis lesions. When we have an older patient, of course, this is much more easy. As you see here, we have a very large rotator cuff tear, and here we have a huge rotator cuff tear and also dislocation of the biceps. So the conclusion is that when we have old people with dislocations or middle-aged people with dislocations, we have about 2 times more frequently tearing of supraspinatus and infraspinatus, but 6 times of the subscapularis. Finally, with these numbering with slap lesions, 20 years ago we started to talk about them, and I think Americans got crazy and started to numbering all these lesions. And I think the most serious thing is to describe which is the connections of the tearing of the labrum with the tissues around. Professor Resnick from San Diego has the opinion that it's not the labrum that extends the tearing inside the superior glenohumeral ligament, but it's coexisting lesions that have to do with repetitive stress. It's something that he told us last summer.
Dr. Natsika, we have 1 minute.
My last minute is about nerve injury. The nerve injury, we're talking about axillary nerve, and we know that it's an often injury that can happen between 14 and 38% of the population that have dislocation, and the clinical findings, you know them better than we do, but they resolve by themselves, most of them. Sometimes we have to take care about this edema that is under the axillary pouch and the inferior glenoid, and to follow it. But as I told you, most of times it resolves by itself. And there is an opinion that, I don't know whether you have seen this isolated atrophy of of the teres minor. Sometimes we are told to ask people whether they have a previous dislocation. So these are the take-home messages to have a look at all these components and to have an accurate diagnosis. I thank you very much.